This video will be covering the mental health problems and illnesses in Australia. What is mental well-being? According to the World Health Organization, mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their ability, learn well and work well, and contribute to the community. What is mental illness? Mental disorder is a health condition involving change in emotion, thinking, or behavior. It can be linked to distress and/or problems functioning in social, work, or family activities. There are a variety of forms of mental disorder. Some common mental disorders in Australia include mood disorder, also known as affective disorder, such as depression and bipolar disorder. Anxiety disorder, where individuals have excessive worry and feeling of fear, dread, and uneasiness. Post-traumatic stress disorder, in which individuals may relive traumatic events through nightmares and flashbacks. There is no single cause for mental illness, however, it is a mix of factors and can affect anyone. Most mental illness are influenced by three factors in individuals' lives. These are biophysical, psychological, and social. Biophysical factors are biological and physical factors that may contribute to developing mental illness. Biophysical factors include family history of mental health problems, which can increase the likelihood of certain individuals to develop mental illness in comparison to those individuals who do not have family history of mental health problems. Furthermore, being diagnosed with medical conditions, especially chronic medical conditions such as cancer or diabetes, can significantly contribute to developing mental illness. Another biophysical factor is the use of alcohol and drugs, which can change the brain chemistry, ultimately leading to developing mental illness, especially mood disorders such as depression. Psychological factors evolve around the mind or the subject matter of psychology, dealing with function of awareness, feeling, or motivation. Stressful life situations such as financial problems or breaking the law are physiological factors that can contribute to developing mental illness. Furthermore, traumatic life experience such as rape or serving in the army can substantially lead to development of mental illness, especially PTSD. Not only this, but also individuals' negative or pessimistic perception of their own self-image and view on life can create a psychological distress that contributes to developmental illness. Social factors involve interaction between family, peers, and other individuals. Negative social interaction can also induce psychological factors which magnify the chance of developing mental illness. Here are some of the common negative social factors which can all contribute to the development of mental health problems.
Current trends, prevalence, and incidence.
According to the Australian Bureau of Statistics, the number of people with mental health disorder is increasing in Australia. About 20% or 4.8 million Australians had a mental or behavioural conditions, which was an increase from 18% in 2014 to 15. On top of that, 13% or 3.2 million Australians had anxiety-related conditions in 2017 to 18, an increase from 11% in 2014 to 15. Furthermore, just for 1 over 10 people, 10.4% of Australians had depression or feeling of depression in 2017 to 18. This was an increase of 1.5% from 2014 to 15. Australian Institute of Health and Welfare also states there was an increase in prevalence of major depressive disorder amongst 12 to 17-year-olds, going from 2.9% in 2014 to 15 to almost 5% in 2017 to 18. Studies also show that specific mental illnesses such as depression were more common in females, 11.6%, in comparison to males, 9.1%.
The National Survey of Mental Health and Wellbeing shows the prevalence of mental illness in the Australian population. The prevalence and incidence of disease is divided into two components. 1. Population-based survey on adults. 2. Population-based survey on children and adolescents. The National Study of Mental Health and Wellbeing of Adults displayed the 12-month prevalence of mental disorder in the Australian population aged 16 to 85 years old. Data from 2020 to 2021 shows that over 2 over 5, or about 44% of Australians in this age range experienced a mental illness at some time in their life, about 8.6 million people. Of these, anxiety disorder were most common, affecting 1 over 6, 17% of Australians. Furthermore, affective disorder, such as depression episodes and depression, accounted for 8% of the total mental illness experienced by the adult population in 2020 to 2021. Following this, substance use disorder were also common, accounting for about 3%. The Australian Children and Adolescent Survey of Mental Health and Wellbeing found that almost 1 over 7, or 14% of children and adolescents aged 14 to 17 years old in Australia were to have experienced some form of mental illness in the previous 12 months. This is about 591,000 Australian children and adolescents.
The most common mental disorder assessed was ADHD, accounted for 7% of all children. Following, 7% of children experienced anxiety disorder, 3% experienced major depressive disorder, and 2% experienced conduct disorder.
Furthermore, a higher number of male children and adolescents, 16%, were experiencing mental illness in comparison to females, 12%, in the previous 12 months. However, the prevalence of mental illness in older females, 13% from 12 to 17 years old, was slightly higher than the younger females, 11%, 4 to 11 years old. Whereas in males, the prevalence of mental disorder in both younger and older age groups did not differ very much. People who are socioeconomically disadvantaged are more prone to developing of mental illness in comparison to those who are financially comfortable. According to the Australian Institute of Health and Welfare, the first quintile, which accounted for 20% of the population with the lowest income, showed the greatest prevalence of mental illness, while the people in the fifth quintile, 20% with the highest income, had the lowest level of mental illness. This is predominantly because population in the first two quintile are most likely to be in grave financial stress. This can lead to a variety of contributing factors of mental illness, such as lack of social life, inability to afford an adequate health service, as well as using alcohol and drugs to cope with pressure and stress.
Another population group impacted are the people living in rural and remote areas. In rural areas, there can often be apprehension around help seeking and fear of stigma, sometimes associated with mental illness. Thus, people living in rural and remote areas are less likely to visit mental health services and seek help, which can contribute to the higher rates of mental illness in this area. Furthermore, social isolation can significantly increase the likelihood of developing mental illness. Mental illness has impacted the Indigenous Australian population more than the non-Indigenous population. This is due to a greater number of Indigenous Australians living in rural and remote areas as well as being mostly socio-economically disadvantaged. Subsequently, this means that the Indigenous population will have inadequate access to healthcare system and education about mental illness, thus failing to recognise risk factors of mental illness. Additionally, as a result of low health literacy, they are more likely to use alcohol and drugs, which contribute to developmental illness. In 2020 and 2021, 11.6 billion government health expenditures was spent on mental health related services. Out of this, around 7 billion was spent on state and territory government mental health services. This includes $3 billion in public hospitals, $2.7 billion in community service related mental health, as well as $1.3 billion on other mental health related expenditures. Additionally, expenditure on mental health related medication was $6.2 billion. This includes common medications such as antidepressants, which accounted for $212 million, and antipsychotics, which was $280 million. However, these costs associated with mental illness can be reduced. One method is for the government to implement prevention and early intervention measures, such as providing education to the younger generation on the risk factors and symptoms of a variety of mental illnesses. This in turn will result in lower rates of mental illness in Australia, ultimately leading to reduction in mental health related expenditures. Prevention and early intervention. Prevention refers to activities to stop social or psychological problems happening in the first place. This can include educating the population about the risk factors that can give rise to mental health problems, as well as protective factors to assist individuals to prevent the development of mental illness. However, on the other hand, early intervention refers to activities aimed at stopping those at highest risk of developing social or psychological problems, or those who show the first sign of difficulty from displaying unnecessarily long or serious symptoms, and prevent it from progressing into diagnosable illnesses. Early intervention methods can take different forms, including home visiting programs, as well as clinical treatment to eliminate the illness at an early stage. The first example of prevention method in Australia is depression in young people. It is a collaborative venture conducted by the New South Wales Centre for Health Services. It aims to improve understanding, recognition, management, and prevention of depression in state secondary school. This method is effective as it allows young people to have extensive knowledge on the risk factors of mental illnesses and improve their health literacy. Another example of prevention program is the online and digital mental health resources. Australian Institute of Health and Welfare, Beyond Blue, and Kids Helpline are some of the examples of online resource platforms. Although this information can be effective in preventing mental illnesses, not everyone will be able to access this information and may be inequitable. Examples of early intervention program include mental health screening to diagnose mental illnesses, assessments, and providing effective medications to help assist in eliminating an individual's mental health problem. This early intervention method is effective and allows medical professionals to personally examine individuals with mental illnesses and provide medically effective solutions, such as medication and treatment, to quickly prevent developmental illness.
One prevention idea that can be implemented to lower the current numbers and lower the costs spent on treatment is to create informative pamphlets about the symptoms, risk, and protective factors of mental illness. The aim of this program is to significantly reduce the prevalence of mental illness in Australia and reduce the prevalence gap between the advantaged and the population most impacted. This will further assist by camp sets by mental health educators providing free consultation as well as the explanation of the pamphlet, especially to those population groups that are most affected by mental illness.
These educational camps will be more prevalent in remote and rural areas, where population groups such as Indigenous people and socio-economic disadvantaged people can easily access.
However, the educational pamphlet will be mailed digitally and made available online to the public who are able to access via websites. Additionally, it will also be made available to certain people who are unable to access the internet by providing them with a hard copy of the pamphlet, which will be available in the local stores and public areas such as the library.
Although this prevention method aims to educate all population about the risk and protective factors for mental illness, it prioritizes the population group that are most impacted by mental illness, such as the indigenous population, socioeconomically disadvantaged, and population living in remote and rural areas. Therefore, this prevention method is equitable as it accounts for not only the wealthy and more stable population, but also a population group that are at high risk of developing mental illness. For this reason, this prevention method will be effective.